Now we'll quickly try to look at the overview. Alright, so this one is kind of like a general look into the cervical vertebrae. So when we look at the general view of the cervical vertebrae, there's some other lectures I will still follow. I'll still come back and do a lecture on the C1 atlas. That's the first cervical vertebrae. I'll still do a lecture on the second cervical vertebrae, which is also known as the axis. Then I'll now come back and talk about these ones, because these ones, they kind of like look similar, so there's a way I'll just discuss the whole of them together. You understand? So the cervical vertebrae, you know that there are about 7 and they are found in the neck. So they form the upper portion of the vertebral column and they are located in the neck. So they are very small and they move a lot. Okay, so that's why you are able to move your neck the way you like. Okay, thanks to these guys, they actually make sure that that movement is there. So location is the neck region between the skull and the thoracic vertebrae. Their shape and type is they are usually irregular. They are actually part of the axial skeleton. So what are the key features? We have the C1, which is kind of like special. It's ring shape, supports the skull, and it helps you to be able to nod yes. We have C2, which has what? An odontoid process. And this acts as a pivot for the rotation of the skull and the atlas. Okay, so you are able to what? Say no, no, no. You are shaking your head from side to side. Yes, you are shaking your head from back to front. Okay, so C3 to C6 they're actually the typical cervical vertebrae. For these ones, they are typically just the same. So they have small bodies, they have bifid processes, they have transverse foraminas. They are about the C7, that's the vertebrae prominence. It's long, it's a prominent spinous process. Or like C7, can I say this? This spinous process, I can easily feel it. And it could serve as a landmark. Once I feel it at the back of someone, I know that, okay, I'm at the level of C7. Okay, so articulation. So superiorly, the C1 articulates with the occipital bone wide down. The C7, okay, we articulate to the first thoracic vertebrae, you understand? So each of them, you should know that what they articulate side to side with, the vertebrae. That's via the intervertebral disc and the facet joints. So they basically support the skull and they allow head movement. They protect the spinal cord and the vertebral arteries. And the articulation makes it that the head is able to move, So they could be affected in all those whiplash injuries. They could be affected in cervical spondylosis. There could be fractures of the atlas and the axis. And you should know that what the C7 spinous process is a clinical landmark, just like I was trying to tell you guys. Once you are feeling it down, once you touch it, you know that, okay, you are actually at this level, and it helps you for examination of a patient.